Hello, dear students and participants. Today is National Deworming Day, so I am going to give you information regarding deworming. The National Deworming Day is an initiative of Ministry of Health and Family Welfare, Government of India, to make every child in the country worm free. This is one of the largest public health programs reaching large number of children during a short period. More than 836 million children are at risk of parasitic worm infections worldwide. According to World Health Organization, 241 million children between the ages of 1 and 14 years are at risk of parasitic intestinal worms in India, also known as soil transmitted helminths. Objectives of national deworming: deworm all children aged 1 to 19 years at all schools and Anganwadi centers for improved child health, nutritional status, access to education, and quality of life. Children aged 6 to 19 years are dewormed at school. Children aged 1 to 5 years and all out of school children are dewormed at Anganwadis. Implementation: National Deworming Day is conducted on February 10th each year. Biannual round of deworming is recommended in the states where prevalence of STH infection is more than 20% and annual round in other 20% prevalence states. Only two states, namely Rajasthan and Madhya Pradesh, have reported less than 20% prevalence and recommended for annual round. All the remaining states UTs are implementing biannual round of deworming. Transmission: adult worms live in human intestines for food and survival and produce thousands of eggs each day. Eggs are passed in the feces of infected person. Infected people who defecate outdoors spread worm eggs in the soil. Eggs contaminate the soil and spread infection in several ways: ingested through vegetables that are not carefully cooked, washed, or peeled, ingested from contaminated water sources, ingested by children who play in soil and then put their hands in their mouths without washing. Types of worms: children aged 1 to 90 years are at risk of parasitous intestinal worm infections known as soil transmitted helminths. Worms are parasites that thrive on nutrition from the human intestine. How do worms spread? Worm infections result from poor sanitation and hygiene conditions. Worm transmit through contact with infected soil. The greater the amount of worms in a child, the more symptoms the infected individual will have. There are three types of worms: roundworm, whipworm, and hookworm. Hookworm look like a hook, and whipworm and roundworm. Soil transmitted helminths. Globally, more than 200 crore people at risk of STH infections. More than 140 crore people are infected. More than 30 crore people suffer from severe morbidity. In India, more than 22 crore children are at risk. WHO has declared India to be one of the highest burden countries of STH infections in the world. India has the highest burden of children at risk of STH. In Southeast Asia region, 64% of the children who require deworming are from India, 15% from Indonesia, and 13% from Bangladesh. India accounts for 22 crore children at STH risk. This is WHO report 2013. Health impact of worm infection. Worm infection poses a serious threat to children's health, education, and productivity. Worms can make children to risk or tired to concentrate in or attend school in the long term. This could affect their work potential and wages. The greater the amount of worms in a child, the more symptoms the infected individual will have. Severe infections can cause a range of symptoms, including abdominal pain, vomiting, diarrhea, and fatigue. Children with mild infection usually show no symptoms. Worm infections, methods of prevention and control. Picture number one, we can see the health education, educate communities to understand the risk of transmission. In the next picture, we can see sanitation, improve sanitation to limit the spread of the disease. Hygiene, improve personal hygiene habits to limit the spread of disease. Deworming, use of medication to decrease infection levels. Control worm infections through deworming. Deworming using albendazole 400 mg chewable tablet is the simplest solution used to treat worm infection. Deworming improves children's health and nutritional uptake and capacity to learn, improves concentration and attendance at school, helps reduce worm infections community, improves work potential and livelihood opportunity, safe for children and adults, doses based on age, frequency of deworming based on worm. Albendazole is safe and highly beneficial. The deworming drug is considered an effective and safe drug approved by WHO. Albendazole is one of the list of WHO and Ministry of Health and Family Welfare, Government of India essential medicines and is effective against a wide range of worms. The drug has been through extensive safety testing and used by millions of people worldwide for treating STH. Worldwide experience of administrating deworming drug confirms that the drug themselves cause only rare, mild, and transient side events, which are generally related to degeneration of the worms that have been killed. Preparation for management of adverse events. We mentioned in this slide what are adverse events. Deworming has very few side effects reported in children. Events such as nausea, vomiting, diarrhea, and weakness may occur among few children, especially those with high worm infections. Any adverse events are temporary and generally can be managed easily at the Anganwadi. Albendazole is safe for both children and adults. Albendazole is an easily chewable tablet. Choking is not to be considered a serious adverse event and is a medication error. Instruct older children to chew the tablet properly. Ensure safe drinking water is available. Still, if the child chokes on part of the tablet, make the child bend over on your lap and pat the child on the back till the tablet comes out. Take the child to an open and shaded place and allow the child to lie down and rest. The role of the teacher. Use a spoon to administer albendazole to the child yourself and not give it to the parents to take home. Inform parents about mild side effects and that it's suspected only in children with high worm load. Build confidence in parents that the child will be taken under observation and care if they show any serious side effects. Benefits of deworming. There's two type of benefits, direct benefits and indirect benefits. Number one, direct benefits, controls anemia, improves nutrition uptake. Indirect benefits, helps improve concentration, capacity to learn, and attendance at school and Anganwadi, helps improve work potential and livelihood opportunity, benefits the community by reducing worm in the environment. Community awareness and mobilization. Anganwadi workers should inform community about the benefits of deworming and dates of deworming, motivate parents and relatives who come to the center to bring their children to the Anganwadi on National Deworming Day. Inform children about deworming and National Deworming Day when they come to the center. Support guides ASHA workers to mobilize community members through Gram Panchayat and VHSNC meetings. Inform community members about deworming messages appearing in newspaper, radio, and TV that they should watch, listen to carefully. Thank you so much.